here, my faculty members and my dear colleagues. So till now we have discussed so much on cancer causing agents, carcinogenic agents, everything. So before going to this topic, when I found in when I found searching in the net, so I found that
MED second year. MED.
So I found that generally in the worldwide statistics, according to 2018, we found that 9.5 million people are dying because of this dreadful disease. As our friend said that WHO, according to the WHO report, we find that cancer is the second leading cause of deaths. And in India, especially, we see that per day, I think 1,300 people are dying because of this cancer. So why is it so dreadful, and what are the causes? What is the prevention measure? Let us discuss each one in detail. Okay. So cancer, due to this awareness, you think that because of it is a dreadful in nature and it is very much prone. We have seen some worldwide programs also. So this national awareness program on cancer has been observed on November 7th, and World Cancer Day is observed on February 4th. The main slogan of this is close the care gap. In this cancer, now coming to what is a cancer and all. Cancer, as we have seen that it is a very dreadful disease, and it, the cells in this cancer, when in a cancer patient, we see unregulated and continuous growth of the cell. In this we see that it is based on the location and size of the tumor. So when the cells completely start dividing, they abruptly, the patient, the changes may occur abruptly in the location, in the size of the tumor. So when this tumor actually bursts out, it also affects the normal functioning of the cells. So here let us see what are the 5 types of cancers. Actually the name of the cancer is given according to the part it is affected. So in this again we have biologically it is classified into 5 types. That is carcinoma, sarcoma, melanoma, leukemia and lymphoma. So in this carcinoma, it is related to glands and connecting tissues. So in this the glands like liver, stomach and the tissues are damaged in this. Coming to sarcoma, in this sarcoma connective tissues, that is soft tissues like cartilage, bone, inside fat and muscle tissues are being affected in this. Melanoma, we know because of the high radiations of UV radiations from the sun, we come across this melanoma disease, melanoma cancer. And then leukemia means, it directly affects the immune system of our body, that is WBCs. And leukemia is blood cancer and lymphoma is affecting WBCs. Now coming to causing why this cancer and how it is caused. First one is unhealthy lifestyle. Because of eating high rich content food and high sugar food, high fat food. So this is prevailing in today's century. And then and exposure to environment. Exposure to environment means ultraviolet radiations, and we see this disease also mainly when they are exposed to ultraviolet rays. When they are working under for X-rays, generally they work in lab technicians will work, right? So in those people also we generally see this type of disease. And hormone therapy also. In hormone therapy also, the people with this hormone therapy, they have to be supplement. Generally we see this hormone therapy cancer in women. See, women they'll go for surgeries and all, right? So at the time of surgeries we see this type of cancer prevailing because the hormones are changed. So we see that there is an impact of this cancer. So now coming to what are the we have seen what are the causes. Now we see what are the stages of the cancer. So in these stages we have 5 stages of cancer. In the first stage, just we will diagnose what is the cancer. That's it. It is limited to a particular area. It is not spread. It is just limited to a particular area. Coming to second stage, it is taking the form of growing stage, but then also it is not spread to the other tissues. Now coming to third stage, it has started multiplying and it has started spreading also. And now in fourth stage, we see it is an advanced stage, we can say. It is for all the tissues it is prevailed. Then we have stage 0 cancer also, where this is we call it a pre-cancerous stage, where it is treated and curable. That is pre-cancerous stage. So now we see the prevention measures. Prevention measures are having a healthy diet, having a soundful sleep. We have to maintain a balanced diet and avoid using of tobacco, smoke, alcohol. And the recent example when I have seen in the YouTube videos, I have observed that a sattvic movement. What do you mean by sattvic movement is when generally we eat in this workload and pressure, we all eat have a late night of dinner, right, at 10 o'clock or 11 o'clock. It is most common. So by 7 o'clock, if you are going to finish whatever the dinner, whatever we eat whatever you want. That is, by 7 o'clock if you finish, then the sattvic movement starts from 7 o'clock, 7 to next day morning, it will be around 11 or 12. So this means there is a gap of at least 11 to 12 years, 11 to 12 hours. Okay, so in this time, the digestive system or the immune system, they will prepare themselves for the next meal. Okay, so this is a basically it gives a very much impact on the human immune system. Okay, now coming to what are the we have seen what are the after diagnosing the stages and all, what are the how we diagnose the cancer actually. So diagnosing cancer consists of we have a test like ultrasonography, biopsy, X-rays, and MRI test, CT scans, everything we have. Now what are the therapies we are using to prevent cancer? So we have seen chemotherapy. In chemotherapy, we use powerful drugs to to damage those cancer-causing agents. So in this chemotherapy, we have one disadvantage, that is by using of heavy dosage drugs, they are even passing through whole body, right? So when they are passing through the whole body, there is a chance of infecting the other good cells also. So in this there is that chance, and what is that? The thing is, we can the side effects of this is nausea and hair loss we can see in cancer. So then coming to we have hormone therapy. I said in hormone therapy. Generally, we see this hormone therapy both in male and female, but in male, if we supplement, if anyone has cancer because of hormone therapy, we give them with the supplement hormones to avoid the cancer causing agents. For suppose a man with prostate cancer is given with supplement hormones to maintain that testosterone level in his body. And then coming to immune therapy. In immune therapy, we see that our body has immune system, and with the use of immune system only, the cancer is treatable here. And with the after immune system, we see stem plant transplantation. Okay, stem cell transplantation. So in this stem cell transplantation, wherever the damaged tissues are there, these are replaced with the new ones, the good ones. And in this, before stem cell therapy, before going to stem cell